All right, we're live on YouTube. We're live on Facebook. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. Today, we're talking about domestic violence and concussions. We started this talk last week, but we had a internet connection failure. So we're redoing it, trying to bring everything back into this talk. Hopefully, all of your questions will be answered. Good morning to everyone who's joining, and good morning to Kathy. Kathy, how are you?
I'm good. Good morning, everyone.
So where do we want to start again, Kathy?
Well, how about, I think it's kind of the main question. Is there something actually wrong in the brain of a concussion patient?
The answer is definitively yes. There absolutely is. And as we talk about traumatic brain injury, and Kathy and I were kind of talking about this morning, is that so many people with mild traumatic brain injuries, aka concussions, are told they're normal because their MRI scans and their CT scans are normal. Nothing is definitively wrong. So it creates a lot of confusion for them and their loved ones, how seemingly small head injuries can result in devastating long-term neurological consequences. So that's really the story. But basically, in the last 10 years, science has evolved, and we now have definitive answers that people who have brain injuries, even if your skull isn't fractured, even if you don't have a brain hemorrhage from something like domestic violence, that yes, there are things that are wrong in the brain of someone who has a concussion, and particularly who develops post-concussion syndrome. So that is the answer.
So then are multiple head injuries a big risk factor later on in life for like Alzheimer's?
Yeah, a lot of those studies have come out regarding the military. So as we're talking about domestic violence today, a lot of the discussion overlaps with post-traumatic stress disorder, and a lot of the research on the domain of traumatic brain injury and PTSD pertains to the military. So in digging into that, they have found that if you have a traumatic brain injury, even one traumatic brain injury can significantly increase your risk of developing something like Alzheimer's. So yeah.
Okay. And then why do some people develop neurodegenerative disease and others do not?
One question or one thought there that they investigated was the ApoE4 allele. So for those of you who are concerned about memory loss or neurodegeneration, Kathy and I did a radio show, it was about a year ago, on this subject. You can get it on our YouTube page. But in essence, if you possess this ApoE4 allele, your chances of developing Alzheimer's are much greater. So if you have a positive family history of Alzheimer's, if particularly in a female, if your mother has Alzheimer's or a grandmother, then you really want to pay attention. And then you may want to get your ApoE status checked. It's a gene test. And if you have the ApoE4 allele, then your chances of developing Alzheimer's are higher. So what they found is that they took like 200 combat veterans and they ran their ApoE4 status, and they correlated that with the thickness of their brain after head injuries. And they found that those who have the ApoE4 allele, that their cortical thickness is significantly reduced as compared to others. So that's definitely something to pay attention to. So the answer is yes, you can develop neurodegeneration, and you want to look at your ApoE4 status.
Okay, so are we ready to take our next track as where concussions come from and what we see?
Yeah, so what was the last thing you said, Kathy?
I said in domestic violence. That's kind of where we were going to head next.
Right, exactly. So that all sets the stage for this topic, because domestic violence is a major cause of head injuries. The statistics are staggering on domestic violence. It's somewhere between 30 to 50% of women report domestic violence at some point in their life, which is pretty substantial. As Kathy and I were talking about too, this discussion doesn't just relate to spouses, it relates to kids. And oh goodness, I mentioned it last week, but I'll go back into it. At Barrow Neurological Institute, it's one of the top neurological centers in the country. It's down in the Phoenix area. They did a study of 115 traumatic brain injury patients, and these are mild traumatic brain injuries. These are not skull fractures. These are not brain bleeds. These are what you would call concussions, related to domestic violence. And they found that 88% of them had repeated head injuries, whereas only 21% of them actually reported the head injuries initially. So that's pretty significant. So, as it pertains to this topic, what we likely have going on is a subset of individuals who are exposed to what's referred to as intimate partner violence, and they're not able to report it, probably for reasons that we can all understand. But they are there, and if you know someone who you think this pertains to, you may want to send them this video, because if they're suffering with symptoms, particularly of brain fog, just not able to think as well, depression and anxiety, the depression and anxiety is not only because of the circumstances of the abuse, but they're finding it is because of the injuries to the brain. So that's what I'd say relative to that.
Okay, but is that exacerbated by the stress of their situation?
I would have to say yes. And that is the difficult part in teasing this out, whether it's someone who is the victim of domestic violence, or if you're in a car wreck and you see a semi truck coming at you, or if you're a combat veteran and you're exposed to horrific circumstances, the stress of the situation has to be taken into account. Researchers, I think it was this year, they did this study where they took rats and they actually injected them with medications that would block stress hormones. And then they put them in a stressful circumstance, and then they induced a head injury to them. And they found that when the rats who received the medications that block the stress hormones, they really didn't develop post-concussion syndrome. So from that, now that's a rat, that's not a human, but it's hard to argue that the stress of the situation doesn't have something to do with it. By the same token, when it comes to validating an injury, lots of times the other side will say, well, okay, you had this injury, you had this head injury, but all of your depression and anxiety, it's really just because you're an anxious person, and yeah, you had the stressful circumstance, but nothing is wrong with your brain. Your brain is absolutely fine, and you're faking all of this. So that's the other side of it. And that's where the research is definitive. And for any of you who want these articles, we have like 25 articles that I'm working off of just for today's broadcast, that there are actual things wrong in the brain of someone who has a traumatic brain injury and PTSD. And those things that we see wrong on a microstructural level are different from those who just have post-traumatic stress disorder and those who just have traumatic brain injury. So the TBI PTSD group is actually showing to have things that are definitive for them. So that's what I'd say relative to that.
Okay, so I think here I'm going to interject because I'm going to use my age again, and I'm going to talk about our society.
Okay.
How we have evolved, and I've seen this. We do think we're more sophisticated. We're not as cavemanish as we were 50 years ago.
Right.
I mean, movies, whatever. Jimmy Cagney shoving a grapefruit in Joan Blondell's face, and really talking down to her and stuff. That was very commonplace.
And what movie was that?
Ago.
Was it like a TV show?
No, this was an actual movie. It's a big deal, and I've heard it talked about years later, always. And it was a black and white movie. Jimmy Cagney, so it was probably in the 30s.
Okay.
Okay. But the same thing. I mean, if we look at Gone with the Wind,
Okay.
Clark Gable's not really nice to Vivian Leahy. There was some stress there, and there was a little bit of stuff going on. There's a lot of different things, even in westerns and things that I've looked at now that come on some of these old channels on TV, and I think, that was really commonplace kind of behavior back then. I remember sitting in church every Sunday morning, and there was a guy in our church, and I was very familiar with this kid. His grandmother lived next door to us, and we played together all the time. And, 7-year-old kids in church, yes, we act up. We like to find something else to do besides pay attention to church. And this guy wore a great big ring, and every time the kid would act up, he would pop him a good one on the top of his head of a 7-year-old child. And I thought, even then at my age, which was 7, I'm thinking, that can't be good.
Right.
And it was repeated. And this was a huge man. He was a contractor. So I'm thinking, 7-year-old kid against a great big old contractor. Probably not the most even odds. Maybe one of the things that affected me that I always fought for the underdog.
Right.
Because they can't fight for themselves.
Right.
And that's
Right.
what we're seeing today. They have shelters, they have different things. They say, get out of the situation. Back then, nobody thought, much about getting out of the situation, although I guess you heard of women just taking off or whatever. But a lot of times they just lived with it. And it had, not the best life. And between the stress and between the injuries, and if we talk about injuries, okay, maybe gives you a shot to the eye one time, which is your frontal lobe area, and the next time he slams you against the wall, so then you're hitting the back of your head.
Right.
You could be seeing a plethora of injuries to
Right.
somebody getting knocked around.
Right. 100%.
So, I mean, it would be a heyday for you because
Right.
you're going to do your testing and you're going to see what all the results are from this and what injuries that have transpired. And you have some idea what you can do to help these folks. But at the same time, society has to realize that, we have enough violence. The guys have to go to war. We have football. We have hockey. We have all this stuff. It doesn't really have to happen in your own home. So that's my spiel on that, whether it be for children or whatever. And I don't know why, but it always comes to my visual thing of when I think about that brain being injured. For some reason, when I hear that shaken baby term,
right,
and I think of that head going back and forth and that brain bouncing around in the skull, for me, that's the biggest visual of how much damage can be done to a person's brain, and especially to a child.
Right, exactly.
So that's kind of my take on where we're at society-wise, how we look at it. It's definitely frowned upon, but we all know what happened, and we have to deal with it, which is where you come in, because you can tell us, how much damage has been done, and you actually know some ways to make some improvements for some folks.
Yeah, on the treatment side, definitely. But I will say you brought up a really good point, because I think some of these patterns, these patterns are replicating themselves. And this is one thought I had, because in that article down at Barrow Neurological Institute, they basically said something like a large percentage of these individuals who are victims of domestic violence were victims of childhood abuse. So, the thought is, well, maybe because they're already, exposed to these circumstances earlier in life, it's more natural for them just to accept these circumstances later in life. But that brings up the point of, what are we doing as a society to prevent this? And I really think, as people talk about education today, and kids graduate high school and they can't balance a checkbook, and all these things us old people say about the new generation. But I really think we could benefit from more public awareness at some point in time, whether it's grade school or high school, as people are starting to become adults, to say, okay, if you were exposed to abuse in childhood, maybe you should have some more learning about this, or maybe we just need more learning about this issue as a whole, because clearly, like you're talking about, Kathy, some of this behavior was just acceptable, 50 years ago, 70 years ago.
Yeah, I mean, it wasn't frowned upon. It was just being disciplinarian, or
right.
Hey, your wife steps out of line, knock her back into line. She doesn't know any better, so straighten her out. And that was a term that was used a lot, straighten her out. And even the Hank Williams Jr. song, attitude adjustment, pop her on top of the head.
True. I've never thought of that song that way. That's a good point. Yeah.
It's a great song, but it's kind of cavemanish. And the education part. I mean, we all took health in school.
Right.
Nobody ever talked about this sort of thing. It's a perfect class to bring this up and do something with it and to inform. They do sex education. They do all this other stuff. Why wouldn't we hit upon something as tragic as this?
I agree, because if 30 to 50% of women are reporting this at some point in time, this is huge. And we know the devastating consequences of this for kids, as well as, partners. So yeah, this is a big, big thing that I think needs to get out there. So if any of you watching this, share this, start this conversation with people around you, because it's going to have to be something like that, grassroots, for us to actually see a change. Certainly we have measures in place in our society for, if somebody observes abuse, they're more likely to call CPS and things like that. But to fix the problem, I just think we need awareness for kids to say, hey, if your dad smacks you upside the head, you need to realize that you're more likely 10, 20 years down the line to smack your kid upside the head or your wife. So we need to start paying attention to this and having more awareness. That's just my little soapbox and tangent.
Yes. Can I bring up my other little nugget
Yeah,
I
yeah,
brought
yeah.
up last week with
Yeah.
you personally?
Mhm.
And that
Yeah.
was what part I would assume, and this is my assumption, and I think you kind of agreed with me, and I think someone should do a study. We talk about MTHFR,
Oh, yeah.
the gene mutation where the
Right.
brain shuts down when it's under stress because it's not getting enough folic acid or whatever.
Yeah. Yeah.
Definitely a chemical imbalance.
Right.
But I really feel like that leads to a lot of this type of behavior. People talk, they get into an argument, whatever the situation is. They don't know where else to go. Their anger is so high, it turns into a rage, and that rage, I really feel like then becomes unleashed in that violence.
Mm-hmm.
And I guess I speak from personal experience because we all know I have MTHFR in my family,
Right.
and it is a gene, and it is a gene mutation, and we pass it on to our kids. It comes from our parents. And we know there are a lot of different strains of it, and it has different effects on different people. But, you know, you and I have laughed about it. I had a lot of rage as a little kid.
Mm-hmm.
And little kids aren't supposed to have that.
Right.
And did not know what to do with it. And it sounds kind of silly, but I was quite a tomboy, and I loved to fight.
Mm-hmm.
And back then, I mean, it still probably wasn't thought of as very cool for a little girl to be fighting, but I had 4 brothers, and you had to survive.
Yeah.
I think it was just something inside me. Like I said, I wasn't being heard. Things weren't gelling the way they were supposed to. So the next thing I'd know, if I didn't know what to say to someone or my brain shut down, I was ready to pop somebody.
Mm-hmm.
And I feel like this has to have a direct correlation with a lot of this. We know MTHFR is in close to half the population.
Mm-hmm.
So those numbers almost correlate with your numbers.
Right. Good point.
for violence.
That's a good point. Huh.
So
I
think
that
I
one.
win this debate.
Duly noted. Yeah.
So we need someone to do a test on this and see what they can come up with, because I think it would be extremely interesting to see what that correlation is. And I'm a huge proponent for people for getting the supplements they need to handle their MTHFR. Because, I was gone this summer, and I was on the road, and it became a time I didn't have a bottle of water, I didn't have my supplements with me, and I went on and off for like 3 weeks, and boy, I could tell the difference when I got back home. I was not a good person to be around. It was just, I wasn't in a good place. I was, any little thing kind of set me off. And as soon as I had like a week of that supplement, you could just tell all that kind of stuff just decompressed.
Totally. Yep. Exactly.
And I could handle something if somebody asked me something that was stressful. I could give them an answer instead of, looking at them and like I'm going to pull their head off.
And I love that. I love that you give that personal example, because I think a lot of people can relate to that. And we don't know why we're angry. And lots of times, like you're saying, so you're in a family who has MTHFR. So guess what? Probably more likely they're going to have depression or anger issues. And that's what a little kid is going to see and expect to be normal, which then patterns behavior, which then results in that little kid when they're an adult doing the exact same thing. So this is breaking the cycle. And I think what Kathy is saying, and really what I've been reflecting on, what do we actually do here at Gatesway Health? We do a lot of things with the immune system and all of this, but we really are helping people to understand their brain. Whether you have a traumatic brain injury, whether you have chronic depression, whether you have anger issues, whether you have irritable bowel syndrome, which relates to the brain, we can show you your brain. We can show you how dense different areas of your brain are. We can show you if there's been brain damage. We can show you how your brain is functioning. We can show you from a genetic perspective how your brain makes neurotransmitters. We can show you how your immune system has been feeding back and screwing up your brain. All these factors are huge, because I think so often, like what you're saying, Kathy, like you go from feeling great, you run out of your supplements, probably don't even realize it. Then all of a sudden you're like, whoa, I'm reacting differently, because you have that awareness. Most people don't. But needless to say, if you're suffering with these issues, there are reasons in your brain why you have them. And so often there's such a stigma surrounding the brain or emotions that nobody wants to talk about it. People go to doctors looking for answers, and the psychiatrist says what? Well, I'm not really here for talk therapy. I'm here to give you medications. You can try this, you can try that, or go see the psychotherapist and talk about it. And all that is beneficial, certainly. But my perspective is, why don't we find out why your brain is not making the right neurotransmitters? Why don't we find out things like MTHFR, which has a huge correlation with addictive personality? So now, your MTHFR status may be playing into alcoholism. And we all know alcoholism can play into abuse for all of those who've been exposed to abuse. I hear these histories all the time. So get understanding on your brain. That's what we're trying to bring to you. And we can actually show you in real time, definitive answers, black and white, what's going on and why you're suffering. So,
Okay.
did we have anything else, Kathy? We want to talk
Yes,
about?
we do a couple things. Okay, the question was, did we cover what kind of percentage of people that are abused get treatment?
Yeah, I think that's the 21% who actually eventually even go in.
All right, so the next one was the important one that I always go to. What effects do the stress hormones have on the brain injury?
So stress hormones damage, and it's deep down the brain. I can't actually show it here. I'm always backwards. It's way deep in there, basically, is the relationship between your fear center and your memory area. Fear center is called the amygdala. Memory area is called the hippocampus. The hippocampus is one of two areas. It grows new brain cells all the time. 700 brain cells should be grown every day in your hippocampus if you're healthy. What they're finding, though, is that individuals who are exposed to chronic stressful circumstances, these stress hormones feed back and they selectively seem to damage the neurons, the brain cells in the memory area, your hippocampus. And so that's what stress hormones do. They also prime your brain. So if you're in a stressful circumstance, you get a lot of adrenaline coming back to your brain, and that seems to set into motion the patterning or the hardwiring of the stressful events. But stress hormones are bad because they damage your memory area. Your memory area, you'd be thinking, okay, my memory, my short-term memory, that's all important, but it's so pivotal because the fear center is next to your memory area. And when you're under stressful circumstances, that fear area can start to grow literally into the memory area, which then sets a tone for your fear center to be over dominant the rest of your life. So you may be just doing something like going into work and you have to give a little speech to your coworkers and it's like the end of the world. Well, that's partly because that fear center is so turned on, possibly. And we also had a question last week that I need to circle back to, Kathy, about repetitive head injuries. So, in the context of domestic violence, a lot of these individuals have repetitive head injuries, clearly because most of them are not reporting them and they seem to keep going. What can that do to the brain? The repetitive head injuries seem to set into motion other degenerative processes in the brain and potentially can be a preceding factor for this thing called chronic traumatic encephalopathy. So I just wanted to interject that before I forgot. Okay, and what was the last thing we had?
The last thing is, do the brain injuries cause neurodegeneration? Can we see differences in the brain between patients that have, let's see, this is kind of messed up.
This is probably my voice texting.
It is. and it's not good syntax, I'm telling you. Do brain injuries caused by neurodegeneration, can we see the difference between the patients with brain injuries versus those who have brain injuries and PTSD?
Yes. So yes to all of that. Yes.
Okay.
So Anne McKee, you all should know her name. She deserves a lot of credit. In my opinion, she may be one of the top neuroscientists of our generation. Somebody who may win a Nobel Prize in the future. She has gone in and she's done all of the post-mortem analysis. That's basically the people who have died, the football players, the boxers, the combat veterans. She's gone into their brains and she's done a lot of the histological examination of the brains. For those of you who watched the movie Concussion, Dr. Omalu was the first neuropathologist to really call this thing or document this thing called chronic traumatic encephalopathy. He came under immense scrutiny, and it seems that Dr. McKee has kind of taken that ball and run with it, so to speak. Nonetheless, she has found signs of CTE in high school athletes who have passed away. She has found signs of CTE in combat veterans, who are young individuals and they've come back, and she's already seen signs of CTE after their blast-related head injuries. So if you have a head injury, and I know a lot of the moms out there are worried, my kid's playing football, are they going to develop, CTE down the line, or my kid's playing soccer, they're doing all these, headers, so to speak. Just know it's pretty significant, and it seems like inflammation relates to the hyperphosphorylation of tau. But these are definitely things you want to be aware of if you've had a head injury, and what can you do to prevent potentially anything from happening down the line. And I think that we're going to have better imaging predictors of chronic traumatic encephalopathy. Just know it's all really new. I can't say anything definitively, but they are starting to see changes in certain areas of the brain in people who are predisposed for CTE. So we're getting more and more evidence. But on the topic of neurodegeneration, that's something all of you really should be aware of. And we got probably about 1 minute. Kathy, anything else before I go let the patients in?
No, I think we covered a lot of stuff. I do encourage everybody again to go on to, like you said, YouTube, whatever, listen to the radio shows and the other casts that you've done, because there's so much information there. And if they can tie all of it together, they have a pretty good idea of what's going on in their brain and their body. And if they need help, they know where to go to find it.
Yeah. Yep, exactly. So yeah, I would say we're trying to bring understanding. We're trying to bring validation, if it's there, for those of you who've been suffering with head injuries and told that you're normal. So if you have any questions, post them on Facebook. We'll be probably talking about something else relative to TBI next week. And I hope you all have a nice weekend. Thank you, Kathy. And
thank you. Bye, everybody.
All right, bye, everybody. Talk to you soon. Let's see here. Da, da. Da, da.